Hey, we're back, and today we have our new finished modded out hospital. It's made from a few of the Lego City hospital sets that came out a while ago, kind of put together along with just a few other things that we built ourselves. The ambulances did come with that set, along with a couple of the other ambulances that came out with other sets back a few years ago. The helicopter did not come with any of the hospital sets. It actually came from the Lego Arctic rescue sets. You can see it's got the snow skis on there, but it does fit really nicely on the roof. It's not too small to where it's not real unrealistic like the ones that came with the hospital sets where you can't actually really carry a person in the back, but it does fit nicely on there. It is a little big, but you gotta work with what we can do. As you can see around the front here, it is a mainly glass building. It's very open and bright on the inside. It's completely finished out. It is a modular set, so we can take it apart and get to each floor individually, which we'll get to. We'll show you all the insides of it, how it's all detailed out. Along the front here, right off the road, you can just see there's a regular entrance just for anybody that's coming into the hospital right off the front. And then along with the ambulance parking bay, there's an EMS emergency only entrance right there, so the ambulance crews can get out and get into their little back hallway. If we just spin the building around, you can see around the back, it's mostly not as much glass because we didn't have as much glass as we wanted to really go around the full building. Is also just some of the rooms didn't look right if they had glass in them, so we did take some panels out just to keep it looking a little normal. But it does still have a lot of glass on the back side. But it is kind of mostly just plain around the back. And you can see the elevator shaft that runs all the way down the back side as well. And now we're just going to get into the inside of it and just show you all the different details we've added in, how the different floors, and just show you what we were able to work with. And starting with the first floor down here, you can see, as I said, it's very open. You can see clearly into all the different windows of what's happening. And if you come over just here to where the ambulance bay is, you can see it's just an empty hallway. It wraps around the back there, and then the EMS entrance, they can just come right in this door that goes straight to the back of their ambulances and also gives them access to the hallway. And then just for anybody that's coming into the hospital for anything else, they can still come in through this main door here. And then if we actually go inside of the building, you can see there's just a small waiting room in here with some paramedics bringing in a patient through the hallway there. And if you come on down, there's just a nursing station right across from the elevator with just a nurse sitting in there working on some patient paperwork. You can see on the computer screens. There's a bathroom for the floor. You can just see right in there. It's just a sink and a toilet, not much going on. It's just a small little bathroom. There's a medicine cart just off on the side of the hallway. And then the two emergency room, triage rooms where they bring in patients to have them evaluated and everything before they get sent off to a different part of the hospital. Then we go on to the second floor here, and this is the floor that has the operating room for surgeries, and it's also got just a couple of recovery rooms and exam rooms, as well as the neonatal unit. And then again, we'll just take another quick look into all of that. Over here is the operating room. You can see they've got all the different machines and equipment in there, and then the light over top, and there's just some people in there operating on the minutes in there. And then down the hallway, room that spans across the entire hallway, here is the neonatal area. You can see there's a nurse in there right now working with the newborn babies. You can see it's an all glassed in area, so you can still see and everything, but it's still a closed off environment. Then there's also another nurse's station over here. You can see there's a nurse standing there. And then finally, come over and you can see one of the recovery rooms. It looks like there's a mother in there with her newborn child, a father. And then one of the exam rooms, there's a doctor in there talking with the patient. Looks like he did something to his arm, so probably just giving him some advice on what to do from there. That's the second floor, just like I said, just the surgery and some recovery rooms, and then go on to the third floor. So So then moving to the third floor. The third floor itself is not one fully connected floor. As you can see, the part off to the side here and then also the balcony are not connected to the actual main structure. They're all held together by the second floor, so it's not level just sitting here, but when it is attached to structure, it's all completely level and does hold together very well. But this third floor area is mostly just the diagnostics area, the labs, the x-ray machines, all of that. And there's also just the balcony off to the side, so patients can come out and get some fresh air. As you can see, you come off the elevator, there's a door that comes into this side of the floor where there is a eye examination room. You can see there's a doctor there performing an eye exam. And then there's also, if you go through the next door, there's an x-ray room where they have an x-ray machine. Looks like a patient's getting his arm x-rayed, and there's the x-ray technician back there behind the glass controlling all of that, and then there's just some extra panels there. So when they need to flip them out. The next area, as you can see, it's got a secured door. It's a secured locked area. This is the lab area. So this is where they send all people's blood work and other lab results that need tests done. You can see there's a person in there working on that, looking through the microscopes, looking at the samples. And then finally on this other part of the floor is the hospital's pharmacy, where you can see there's a pharmacist there with the prescriptions and everything. And you can see the patient just dropped off his prescription order and just got his prescription for what looked like another broken arm there. And then again, coming through another sliding door, you come out to the balcony area right here. So if you come up to the fourth floor, it's kind of a floor that's split into two sections. So it's got the patient recovery rooms, intensive care rooms over here, and then it's got some staff rooms over on this side. So I'll start on this side, and you can just see it's a supply room, so they got an extra wheelchair, some bed linens, everything like that. And then the next room over is going to be the break room, so you see there's a couple staff members in there, just getting something to drink, maybe something to eat, read a newspaper while they're on their break. And if you come out into the hallway, you can see there's a doctor there next to the cart, reading over some patient charts. And then he comes into this room, and first intensive care room over here, you can see there's a patient in there with a family member sitting there reading the newspaper, and there's also another patient that's going to be in this room. So you can see that's just all the fourth floor has really to it. It's just mostly just recovery rooms and staff rooms. And if you come up just to the roof area, you can see that there's the helicopter landing area up here. It is kind of a little big for the roof, but it's the only helicopter with that kind of size that actually fits a patient in it that can still reasonably fit on the roof. The only option was the other larger Coast Guard helicopter, and that would just be too big. But you can see there's some flight paramedics. They're taking a patient off the helicopter, taking him over to the elevator shaft. Let's go down to probably the surgery room, get some better care. But other than that, the roof is pretty normal. It's got some air conditioning units at the top here for the hospital. But other than that, that's really all there is to the roof area. So there you have our new Lego City Hospital. Like I said, it's been kind of put together from a couple of the hospital sets, all kind of mashed together, along with some of our own stuff that we've done to it. But we're just going to go throw it up into the city now and let you see how it looks up there. So here we have the hospital in the city. And as you can see, it's in the back part of the city here, over by the beach and the neighborhood back here. And it's just off in the corner away from where the stadium and the new firehouse and transit stop is. But if we can just bring you over here, you can see it just goes right down that road underneath the monorail tracks, and then just wraps around just like how I had the road in the video earlier downstairs. But yep, that's just the spot it's going to be in for now. It sits nicely in the back. You can still see it from most places. It's a pretty tall building for the area it's in. But that's our new hospital. Let us know what you think about it, anything you like, anything you don't like, and thanks for watching this video. We'll see you in the next one.